Hi friends, good evening and welcome back to my channel Mukambika Nursing. Friends, we all know the MNS exam is on 14th January. Here we are discussing previous year MNS exam questions and also we are discussing ESIC previous year questions and answers. Surely these questions will helpful for your studies. We can see the questions. First question. The heat regulatory center of the body is located at options. Option A medulla oblongata, option B thalamus, option C hypothalamus, option D lymphatic system. Heat regulatory center is located at hypothalamus. Option C is the correct answer. Location of a respiratory center is medulla oblongata. Also cardiovascular center, also medulla oblongata. Here heat regulatory center or temperature regulatory center is hypothalamus. Move on to the next question. The outermost layer of blood vessels is options. Option A tunica adventitia, option B tunica media, option C tunica intima and option D myometrium. Outermost layer of blood vessels is tunica adventitia. Option A is the correct answer. The innermost layer of blood vessels is tunica intima and outermost is tunica adventitia. Move on to the next question. Glycosylated hemoglobin test means glucose level. Option over 2 days, option B over 14 days, option C over 30 days and option D over 90 days. Here correct answer is over 90 days. Glycosylated hemoglobin or HbA1c means the amount of blood glucose bound to hemoglobin. Here the glycosylated hemoglobin test means it detects the amount of blood glucose in past 3 months or over 90 days. Here option D is the correct answer. And the next question, increased glucose tolerance test is seen in options. Option A hypopituitarism, option B hyperinsulinism, option C hypothyroidism and option D all of this. Increased glucose tolerance test is seen in all of this. Glucose tolerance test means the ability of the body to absorb and use glucose is known as glucose tolerance test, and it will be increased in case of hypopituitarism because of the low growth hormone and also in case of hypothyroidism due to decreased production of thyroid hormone and increased production of insulin. So these all cases the glucose tolerance test will be increased. The next question, community health nurse explained a new diagnosed diabetes mellitus patient that the purpose of medication is to treat. Option A hypoglycemia, option B hyperglycemia, option C hypocalcemia and option D hypercalcemia. A community health nurse is giving education to a newly diagnosed diabetes mellitus patient that the medication is to treat increased sugar level. Increased sugar level means hyperglycemia. Okay, option B is the correct answer. And the next question, the ideal angle of insertion of intradermal injection is option A 15 degree, option B 30 degree, option C 45 degree and option D 90 degree. The angle of insertion of intradermal injection is 15 degree. Option A is the correct answer. The ideal angle for insertion of intradermal injection is 10 to 15 degree angle. If it is 10 degree in our option, that is also correct. Here 15 is there, so that is the correct answer. And the next question, which gauge needle is used for intradermal injection? Option A 21, option B 23, option C 24 and option D 26. Correct answer is option D 26. For intradermal injection, the size of the needle is 26 or 27 gauge diameter. The next question, damage to which heart chamber cause acute pulmonary edema? Option A left atrium, option B right atrium, option C left ventricle and option D right ventricle. Damage to Which heart chamber cause acute pulmonary edema? Correct answer is option C, left ventricle. The next question, CVP catheter is inserted to measure all of the following except option A mean right atrial pressure, option B pulmonary capillary wedge pressure, option C pressure in superior vena cava, option D right ventricular preload. Correct answer is option B pulmonary capillary wedge pressure. CVP catheter means central venous pressure catheter. The next question, at which age a child can start to recognize his mother? Option A 2 months, option B 3 months, option C 6 months and option D 7 months. Correct answer is option B 3 months. A child or a baby can recognize his mother at the age of 3 months. It is one of the social development. And the next question, at which age stranger anxiety start to develop in a child? Option A 2 to 3 months of age, option B 4 to 5 months of age and option C 6 to 7 months of age, option D 10 to 12 months of age. Stranger anxiety will start at the age of 6 to 7 months of age. Option C is the correct answer. By the age of 7 months, the baby can show anxiety on meeting strangers. And the next question, birth weight of a baby triples at option A 9 months, option B 12 months, option C 15 months and option D 18 months. Birth weight of a baby triples at 12 months. The average birth weight of a newborn is about 2.5 to 3 kg and its birth weight doubles at the age of 5 to 6 months and it triples at the age of 1 year. Okay, here 12 months is there, so that is the correct answer. And the next question, at which age the length of the baby doubles of the length at the time of birth? Option A 2 years, option B 3 years, option C 4 years, option D 5 years. And the correct answer is option C 4 years. Birth length of a baby is about 45 to 50 centimeter. Okay, and the birth length doubles at the age of 4 years. Here question is, length of the baby doubles at the length at the time of birth. Okay, so at the time of birth 45 to 50 centimeter, it doubles by 4 years. And the next question, drug of choice in drug-induced anaphylactic shock or anaphylaxis is option A adrenaline, option B noradrenaline, option C dopamine, option D heparin. Drug of choice in anaphylactic shock or anaphylaxis is adrenaline. Option A is the correct answer. The next question, drug of choice in pregnant woman with HIV infection to prevent its transmission in fetus. Options, option A lamivudine, option B nevirapine, option C tenofovir, option D pseudoudine. And the correct answer is option B nevirapine. Here question is, a drug of choice in pregnant woman with HIV infection to prevent its transmission to fetus. Okay, from mother to fetal transmission can prevented by using the drug of choice is nevirapine. The usual drug of choice in HIV treatment is pseudoudine. Okay. The next question, diphtheria bacillus was discovered by options, option A Landsteiner, option B Klebsiella, option C Neisser, option D Robert Koch. Diphtheria bacilli was discovered by option B Klebs and Lofer. The next question, father of immunology is option A Joseph Lisner, option B Edward Jenner, option C Louis Pasteur and option D Robert Koch. Father of immunology is Edward Jenner. Option B is the correct answer. Joseph Lisner, first option, is the father of antiseptic surgery, and Louis Pasteur, father of microbiology, and Robert Koch, father of bacteriology. And the next question, first live vaccine was developed by option A Joseph Lister, option B Edward Jenner, option C Louis Pasteur, and option D Robert Koch. First live vaccines was developed by Louis Pasteur. Option C is the correct answer. Move on to the next question. The Protection of Women from Domestic Violence Act came in option A 2005, option B 2006, option C 2012, option D 2015. Protection of Women from Domestic Violence. Correct answer option A 2005. And the next question, Pradhan Mantri Jeevan Jyoti Bima Yojana is started in option A 2005, option B 2018, option C 2012, option D 2015. Correct answer option D 2015. Pradhan Mantri Jeevan Jyoti Bima Yojana. The main objective of this program is to encourage the life protection of low income society. It started in the year 2015.